In recent years, the rising costs of prescription drugs has become a highly politicized topic in the United States. From 2008 to 2016, the average price for brand name oral medications has risen at a rate of 9% per year, which is 5 times faster than the rate of inflation during this period. Further examination concludes that half of the 36 top-selling prescription drugs from 2012 to 2018 doubled in price. This is an outrageous increase in price and has some citizens screaming out for assistance. In order to delve into this topic fully, we first need to understand why. Usually, when a drug's patent expires, competitors jump in and sell less expensive generic versions of that drug. Recently, manufacturers have gotten around this by making minor tweaks, such as changing one ingredient or creating an extended release variation of the drug, that are able to reset and lengthen the time left on the patent. Additionally, these big pharmaceutical companies have been known to pay competitors to not sell generics even after they legally can. This tactic is known as pay for delay. By using these loopholes, big drug companies are able to dramatically drive up their prices with little competition. Now we understand how they are able to drive up these prices, but what can we do to stop them? In our case, relating to prescription drug prices, the two main solutions are either to increase regulation in this private industry or a government takeover and complete control of the healthcare industry. Currently, negotiations between Medicare and pharmaceutical companies over drug prices is outlawed. But if this is overturned and someone with a plan to outlaw private health insurance and implement a Medicare for all policy is elected, Bernie Sanders is one of these people, then everyone in the United States would reap the benefits of lower drug prices. Now, let's say someone with a healthcare plan that provides an option of public health but doesn't completely eliminate private insurance healthcare is elected, then it's uncertain who would reap the benefits of these lower drug prices. Honestly, in this example, it would most likely only be the people that are under this public Medicare option. NPR, National Public Radio, questioned all 20 Democratic candidates for president earlier this year, asking if the federal government should be able to negotiate prescription drug costs. All but 2 believed yes. Some believe that government control provides us with the most reliable option, but others worry that we will be giving them too much power. Now, let's say the person elected to president or into office isn't in favor of government-run healthcare and instead votes to increase regulation in the industry. Under these circumstances, the desired outcome is that the big pharmaceutical companies are forced to make a price ceiling or succumb to another economic restraint that doesn't allow them to keep jacking up the price of their goods. This option would most likely come from a Republican candidate whose ideology is much more anti-government than a Democratic candidate. I believe that both parties, Democrat and Republican, want the best for our country, and their different ideologies presents a classic philosophical question. How involved should government be in their citizens' lives? In our country, we've distributed power across national, state, and local governments so that they can hopefully balance each other out and hold each other in check. Government is meant to ensure a just society where order and harmony exists. Additionally, it is meant to establish and enforce moral and ethical standards so that society functions correctly. Not all aspects of ethics and morality can be entrenched into law. Therefore, when can we say that government is overstepping our boundaries? The debate on rising drug prices has become political, and the idea of government control on prices is often argued upon. Both parties recognize that there's an issue at hand, but their solutions to this issue take different approaches, as we've talked about previously. Generally, the Republican Party is very libertarian and capitalistic and wants all business to be privately owned and run. Oppositely, the Democratic Party is known for promoting equality and implementing welfare policies that are government run, such as the healthcare for all option that we talked about above. These separate ideologies are what often prevent the two parties from coming together on any type of legislation. They just keep arguing back and forth with each other. For example, during this most recent election cycle, Democratic candidate Bernie Sanders wanted to completely get rid of private health insurance, implementing the healthcare for all policy, and implement the healthcare for all policy. Most Republicans disagree with this idea. They would rather have it be a private regulation change, as they don't mind the healthcare industry being privately run and see government healthcare as a threat to our individualistic establishment.